Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What is the treatment of meningitis? Fine. Treatment of meningitis mainly depends upon the cause of meningitis. So whenever there is meningitis, we should do CSF examination, and based on that we should find out whether the cause is bacterial, viral or fungal. If the cause is bacterial, then with culture and sensitivity of CSF we can pinpointly identify which bacteria is causing the meningitis. So based on the bacteria which is causing meningitis, we give the treatment. Similarly, based on the virus and the fungus, treatment is given. Now, if in any case, before, because doing culture and sensitivity of CSF takes time, so before we know the exact organism, during the in that timeline we should give empirical therapy is given to the patient. In empirical therapy is given with third generation cephalosporins. Third generation cephalosporins are given along with vancomycin is given as the empirical therapy of meningitis. Then, if there is first, if there is Neisseria meningitis. Neisseria meningitis is a gram negative cocci, diplococci. If gram negative diplococci like Neisseria meningitis is causing meningitis, in such cases we give either a penicillin G is given or ampicillin is given to the patient. Along with, you can give either the ceftriaxone or cefotaxime is given for 7 days. So the treatment is we give penicillin G is given or ampicillin. Among these both, one is selected, either penicillin G or ampicillin, with ceftriaxone or cefotaxime is given for 7 days. Then, if the meningitis is due to the organism Streptococcus pneumonia, which is actually a gram positive diplococci. In Streptococcus pneumonia, which is gram positive diplococci, in this case we give a drug which is we can give penicillin G with penicillin G can be given with vancomycin, and ceftriaxone can be given for 14 days. Okay, so penicillin G, vancomycin and ceftriaxone is given for 14 days in streptococcal pneumonia causing meningitis. Now, if the meningitis is due to gram negative organisms resulting in meningitis, in them we give either the ceftriaxone can be given to the patient, or we can give the drug cefotaxime is given to the patient in case of gram negative organisms. If pseudomonas is causing meningitis, then we give the drug ceftizidime is given to the patient if pseudomonas is responsible for meningitis. If staphylococcus is responsible for meningitis, then we can give the drug nafcillin is given to the patient with vancomycin can be given to the patient. Then if it is a listeria gram positive listeria monocytogenes, which is a gram positive bacilli, is responsible for meningitis, in such cases we can give the drug ampicillin for a duration of 21 days it is given. Then if Haemophilus influenza, which is actually a gram negative pleomorphic coccobacilli is causing the meningitis, then we can give either the ceftriaxone or cefotaxime is given to the patient.
thank you and thank you for watching.